Okay, we now have details on the more permanent but still temporary rules that will take effect for prescribing controlled substances after public health emergency ends on May 11th, 2023. So just published on May 10th, DEA came out with an extension of the temporary COVID era exceptions to the Ryan-Haidt Act of 2008. For background, the Ryan-Haidt Act of 2008 constituted a nationwide ban on prescribing controlled substances without an in-person medical physical examination prior to that prescription occurring, with limited exceptions. And we've covered that in detail on this blog and in the book, The Practice of Telemedicine, which is available on Amazon. We've covered that in great detail. One of the exceptions to that in-person prescribing requirement is public health emergencies declared by the Secretary of Health and Human Services, which, as you might have been aware, has been happening for the past 3 years. That public health emergency, though, is set to expire May 11th, 2023. The rules that have been in effect for the past 3 years were that the Secretary of Health and Human Services, along with DEA, allowed some flexibilities in not requiring in-person exam before the prescription. So knowing that the PHE was ending on May 11th, DEA and a couple other organizations put forth proposed rulemaking and submitted public comment, as is the typical procedure. They did that back in February of 2023. They received a record number of public comments, most of them asking for more flexibilities or more permanent flexibilities. And so as a response, DEA has come out and actually kind of responded to those public comments. So let's jump into what it actually means for you with this new temporary rule. So their initial temporary rule was a 6-month extension, but everybody agrees that's not long enough. So right now, the more permanent but still temporary rules go like this. The full set of telemedicine flexibilities regarding prescription of controlled medications as were in place during the COVID-19 PHE will remain in place through November 11th, 2023. Meaning, so long as it's done in the usual course of practice and it's for a legitimate medical purpose, you can prescribe controlled substances without first having an in-person physical exam of that patient. You can do that up until and including November 11th, 2023. Additionally, for any relationships that have been or will be established on or before November 11th, the full set of telemedicine flexibilities will continue to be permitted via a 1-year grace period through November 11th, 2024. In other words, if a patient and a practitioner have established a telemedicine relationship on or before November 11th, 2023, then those same telemedicine flexibilities that have governed the relationship to that point are permitted until November 11th, 2024. So in other words, if you see a patient via telemedicine on or before November 11, 2023, you may prescribe controlled substances, provided you're meeting legitimate medical purposes, for the next year, for the next 12 months after that. Any relationships that are established on November 12th, 2023 or after will require an in-person examination prior to the prescription of controlled substances. So in effect, what DEA is doing in this temporary rule is saying we have 18 months to really kind of get all of our policies and procedures in place from a provider standpoint, and also not leave patients hanging in what people are calling a prescribing cliff. So what's coming next and what are the rules that you have to comply with, even though there are some flexibilities? So there's 4 basic requirements. One is the prescription is issued for a legitimate medical purpose in the usual course of your professional practice. It must be, ideally, audiovisual, real-time interactive communications, so Zoom visits, HIPAA compliant Zoom visits, or otherwise audio video conferencing. Except mental health disorder. If a patient is not capable of or does not consent to the use of video technology, it can be audio only. Third, the practitioner must be authorized under their registration to prescribe the basic class of controlled medications Basically, you have to be registered with the DEA. And then fourth, it must be consistent with all other requirements of 21 CFR Part 1306, or just other DEA controlled substance rules. So you're complying with all the other rules for DEA prescribing, but you may do it under this limited time exception for the next 6 months for sure. And then any relationships after 6 months from now, or November 12th, 2023, requires an in-person visit. And that's going to buy DEA time to put forth more permanent rules that will not be sunsetted in 18 months. It'll let them kind of comply with their stated mission of ensuring a smooth transition for patients and practitioners, as well as allow them adequate time to not let patients have a prescribing cliff or lose continuity of care. So for more information on this and any other topic, please be sure to subscribe to Functional Lawyer on YouTube or our newsletter. And if you need any help, you can always reach out to us and set up a consultation anytime. So with that, thanks, and we'll see you next time.